Do you have trouble walking through the grocery store? Hey folks, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas. In today's video, I'm going to give you something to look out for the next time you go to the grocery store, okay? Most of you are going to be able to immediately identify what is wrong with some of the folks that you see walking around the store. First though, if you're watching on YouTube, make sure you hit subscribe. We got some really good videos with lots of really solid evidence-based information that I don't want you to miss. So hit those buttons. Before we get into everything, I want to set the stage just a little bit. Low back pain is a fairly diverse issue. It can be caused by a lot of different things. In fact, for some time now, low back pain has been the leading cause of disability globally, meaning that around the entire world, the most common reason people are disabled is because of back pain. What's even more worrisome is that it is only getting worse. It's getting more and more common. In fact, from 1990 until 2017, the number of back pain sufferers at any one time in the world went from 377 million all the way up to 577 million. That's 200 million people more in pain since 1990. That's incredible. And all of that pain at a time when opioid painkillers, they're being basically eliminated. Just to continue with a couple of more numbers here and maybe show you that maybe the news isn't all bad, out of 56 million Americans that have back pain at any one time, really only about 5% actually need any kind of surgery. Now what that means is that a lot of back pain resolves on its own. That's excellent news. It also means that the pain that does not resolve on its own, it can be treated by professionals that know what the heck they're doing. First, the most common reasons for back pain. Here they are. The very most common, most prevalent condition, in fact, about 40% of the back pain patients that come through a clinic of any kind with back pain, they're suffering disc conditions. Yeah, that means disc degeneration, disc herniation, disc bulges, disc desiccation. There's lots of disc issues that can happen. But 40% of back pain patients under the age of 60 that come into a clinic, they have a disc issue. The next most prevalent thing, about 30% of the patients that come through a clinic with back pain are facet joint pain patients. Facets can get fired up from synovial fold extrapment, entrapment. Don't worry about these big words. It's going to get easier. Facet joint dysfunction, age-related facet joint hypertrophy where they grow. So don't worry about all those words. It's going to get easier, I promise. The next third most prevalent thing, about 22.5% of low back pain patients have sacroiliac dysfunction or pelvic dysfunction, okay? And keep going on down the line. We've got sprain strain issues, we've got stenosis, and then all of the other little causes of low back pain that are just so rare, we're not going to get into them here. Now, sometimes it's a mix of all of these conditions, okay? It can be complicated, to say the least. But that doesn't mean that we can't do something about it. In fact, the American College of Physicians and the American Family of Physicians both recommend the services that chiropractors very commonly offer as first-line therapies for back pain of any kind. A knowledgeable and well-educated, evidence-based, and patient-centered chiropractor can make a huge difference for most of these back pain cases. Now, I want to dive in a little deeper on just one of these little causes today. Let's shine the spotlight today on stenosis, since in my clinical experience, it seems to be the one that patients are really the least familiar with. Now, I'll start by just simply defining the word stenosis, okay? The word itself just means narrowing, all right? The way I describe it to my patients is that it means that we have a hole that a lot of important stuff goes through. For one reason or another, that hole has become smaller. So it has essentially become a real estate issue, basically. There are some more common reasons for this narrowing or real estate issue, but they are disc bulges or disc herniations, disc degeneration, right? As the space where the disc exists is reduced by issues of the disc, well, the space containing the hole that all the important stuff like nerves runs through, well, it also becomes reduced many times. The next common thing that can cause stenosis is facet hypertrophy. Now, the facets are the joints on the back side of the spine. Over time, the bone of the facet joints of the spine can have the tendency to increase in size. When bone experiences pressure or tension, many times it responds by laying down more bone. Facet hypertrophy is a buildup of the bone of those joints, and the increased size of the joints can be a cause of the narrowing. And then the last thing we'll talk about is the ligamentum flavum. Now, this is a ligament. You don't have to know anatomy, just hear me out. This is a ligament that kind of runs down the canal next to the spinal cord. It can get inflamed, and when it gets inflamed and larger, it can be another source of this real estate issue. An easy way to identify or remember stenosis is by the grocery cart sign. As I mentioned at the beginning, I'm going to give you something to look for at the grocery store in your next visit. Be sure to pay attention to how older folks walk around the store. Stenosis usually hits people over the age of 60 years old. In classic stenosis, people will experience pain in the legs and the back when they stand up or start walking. On the other hand, it feels much better for a stenosis patient to sit down. They bend forward at the waist. Basically, sitting or bending over at the waist opens the holes that have created or that have the limited real estate. Standing, however, closes them down even more. The grocery cart sign is when they're leaned forward on the grocery cart as they walk around through the aisles of the grocery store. When they bend way over and lean their arms and elbows on the cart, it helps open those holes up. It feels better. It allows them to get through the store without being completely miserable. And many don't even mess with the cart. They just go straight for the motorized buggy there to get the shopping done. And while pain on walking and pain when bending backwards are very common symptoms of stenosis. Remember, pain when standing up and walking or pain when bending backwards, right? Those very common symptoms of stenosis. But there's also research from 2009 that suggests that leg cramps at night are frequently experienced with those having low back stenosis. Considering the fact that stenosis is a physical, restrictive issue, meaning it's a lack of physical real estate, right? Considering that, can anything other than surgery to create more real estate, can anything else actually be helpful? Well, it turns out that the answer is yes. I use the latest hands-on, conservative, non-invasive techniques, and our patients are getting excellent results here. Nothing is a silver bullet, okay? Nothing in healthcare anyways. So not every patient experiences complete resolution, but many do amazing and have a drastically improved quality of life after undergoing treatment with us. The program I use for stenosis treatment comes from researchers at Mount Sinai Hospital and the University of Toronto, and it's been well validated through solid research. It consists of 2 treatments per week for 6 weeks. Exercises done with me or my staff here in the office, as well as a complete protocol of exercises to be done at home every day. Now, these exercises focus on helping the patient strengthen or stretch specific groups of muscles while teaching the patient how to walk and move about in a much more comfortable way that will create more real estate and reduce pressure in that low back when standing or walking. Now, research has been very clear that it's not necessarily how the holes are narrowed as much as what happens to the contents of the holes. And if we can help our patients reduce the stress of the contents, the hole can remain the size that it is while the patient can still function normally. Kind of like learning to downsize your house in a sense, learning to live in a smaller house. The most important thing to understand, though, is that stenosis does not always require surgery. Surgery should never take place without first trying non-pharmacological, non-invasive treatment, and a solid, evidence-based, patient-centered chiropractor is an excellent place to begin searching for solutions. Again, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas. If you're watching this on YouTube, hit that subscribe button and maybe share with a friend that could use this information. Same goes for Facebook. If you're looking at this on Facebook, hit the like. Leave us a comment. We'd love to know what you think about these videos. And then make sure you share with your loved ones, okay? If you're from the Amarillo, Texas area, or you're going to be traveling through and you need to be seen, give us a call at 806-355-3000. I'm happy to help you. I look forward to it. Until next time, take care.